These usually are caused by a deeper problem, and this can be an isolated superficial problem that we can treat with injections. And over here, this is also a nice network of reticular veins, right? There's usually a feeder vein down here, so this would be a perfect patient for sclerotherapy. We would treat that with sclerotherapy. Right here, we've decided to do a duplex on this patient, which is an ultrasound, because she has fairly significant varicose veins, and the question we have is, what is the source of the problem? And the only way to find out is to do a formal duplex. The femoral vein, the deep system, and then you have the saphenous vein, which is coming to join the femoral vein. Continuing with the ultrasound, and I'm now focusing on the saphenous vein in the mid-thigh portion. And already on this patient, which has mostly an accessory vein, this is a beautiful image. Get the sound as well of a saphenous vein that's perfectly normal. Okay, so this patient has a normal saphenous vein, which has a functional valve, and you can see it that you see the blood, it just stops. It doesn't flow because there's no reflex in this vein, and therefore we have to consider that this vein is normal. We don't want to remove it, but she will need something done for the accessory vein itself. So look at the difference between the first image and this one here. You see that the valve doesn't want to close completely. There's more reflex here. There's flow, and this is significant reflex. Are looking at a network of very significant varicose veins that are all attached to what we call an accessory vein. So this is the anterior saphenous accessory vein, and this is the culprit. This is the reason why this patient has these big veins. And we're just going to show you that the trunk here, the origin, has reflex. Okay, so I'm not even doing anything, and as the patient is breathing, you can see that there's flow in this vein that's going both ways. So usually that means that there's a lot of reflex, and if I actually push the blood upwards, it's going to fall right back down. I push it upwards and it falls back down with a lot of reflex.